Hello, this is Dr. Pawan Kumar, and I'm senior neurophysiotherapist here. And I'm specialized in neuro conditions, especially in vestibular rehabilitation. And generally, we have dizziness as a complaint in the vestibular patients. They will have balance issues, they will have dizziness, they will have giddiness, and they will have increased frequency of fall. We see those kind of things. Patients will feel like they're falling very frequently and so suddenly when they change the position of their body, like from sitting to standing or lying down to sitting. And while walking also sometimes we will have those dizziness symptoms. So we diagnose this as central vertigos and peripheral vertigos. And in these conditions, these dizziness will come like in post-operative, post-surgical situations or post-traumatic situations, or if you have any ear issues like Meniere's disease kind of things. And if we have vestibular disorders, we see those dizziness as a combined ones. So we assess these cases whether there is involvement of vestibular system or any other reasons. So we differentiate the vestibular system with the other conditions like post-traumatic ones or post-surgical ones or central vertigos. We differentiate those things. So if it is a peripheral system or vestibular system is involving in this one, in that one we will see very most common one is like posterior canal PPPV, that is posterior canal benign paroxysmal positional vertigo. And these ones, whether it is a posterior or whether it is a lateral canal or whether it is anterior canal, we diagnose with assessment tools like Dixalpix manuals. We'll see there is involvement of posterior canal or whether there is involvement of lateral canal or whether it is unilateral or bilateral. If it is unilateral, we treat in the same day with the correction manuals or repositioning manuals, that is your Eplis manual. That helps in reducing the dizziness symptoms up to 90% in a single session. After that one, we'll teach some precautionary measures and we'll teach adaptation exercises if the patient doesn't have any balance issues or any issues while walking. These symptoms last for 20 seconds or 30 seconds till 1 minute. In those cases, we treat this one in a single day and we'll advise the exercises for a week. If these symptoms are lasting bilaterally and for longer time, then we treat this for 3 days. The patient will come to clinic for 3 days or hospital to 3 days. We'll treat them unilaterally on one day and the other unilateral one on the other day, and we'll teach the exercises for a 1 week or 10 days. For suppose if the symptoms are very much severe, like if the patient is having symptoms while changing the positions, along with that one when the patient is walking, if the patient is having balance issues during the vestibular issues, along with the vestibular issues, then the patient need to have balance rehabilitation also. Balance training also patient requires during his rehabilitation course. In that cases, we advise the patient to come to the clinic to treat the balance issues also. During the balance issue treatment only, we treat vestibular issues, the corrections and the adaptations along with the vestibular adaptation exercises. Along with all these things, we treat him in the static balance, dynamic balance during standing and during walking. If the balance is more affected, the gait will be affected. In those cases, we treat pre-gait training and gait training in different situations like narrow areas, like uphill areas, downhill areas, and the soft areas like during the walking in the mud kind of things. In these cases, we train pre-gait and gait training in the different surfaces. That's how we treat vestibular rehabilitation and vestibular disorders. We plan the rehabilitation in the vestibular issues, including balance problems and gait problems.